Hi, this is Megan Mitchell. I am a licensed independent clinical social worker in Washington, D.C. And today I am excited to talk to you all about vicarious trauma and what that looks like and how you can prevent burnout in the workplace. So, I think that if you're working with clients, you are bound to work with clients that have experienced trauma. And it's important that as social workers and mental health professionals, we are also taking care of our own needs and making sure that we are practicing self care, setting those boundaries so that we're not getting burnt out, because we know that burnout leads to poor job satisfaction and a lot of job turnover. So, a little bit about me. I am the founder of Agents of Change. We are so excited to launch our training institute. I've worked primarily with children and adolescents. I've worked in a variety of different settings. I currently am doing clinical social work in private practice. I'm also getting my doctorate in social work from SUNY Buffalo. And I have now lived in Washington, D.C. for the past over 10 years, but I originally am from Michigan. So just a little bit about me. And of course, throughout my career, I have worked with clients, families, children that have experienced trauma in a variety of different settings. I have been burnt out. I have experienced vicarious trauma. I've had to process this in supervision with colleagues. So it's something that's really important to me because we want really everyone to be in a place where they can be able to do their best work. And sometimes because we are working with really hard cases, that can be really difficult. So we need to make sure that we are taking care of ourselves and realizing when we're maybe hitting a wall and need to take a step back. So you've probably heard the word vicarious trauma, but you might be wondering what it is. It's often secondary trauma or secondary stress due to the emotional or psychological harm that occurs from working with a client, an individual, a family system who has experienced traumatic events. And there are some practitioners that fully work with trauma. That is their area of expertise. There are some people that work with little t trauma. Those are traumas that, everyone experiences some sort of setbacks, challenges, difficulties. And then there's big T trauma. That is those traumas that are very severe and cause a lot of, like we said, psychological, emotional, or physical harm or impact. It can affect a variety of professions, so it is not unique to social work, mental health professionals in general, healthcare workers. You have to think that a lot of nurses and doctors and medical staff during the COVID pandemic were experiencing vicarious trauma. First responders, so EMTs, firefighters, and of course, those working in mental health field. It also can reach to teachers, educators, people that spend time with anyone that has experienced some sort of trauma is at risk of experiencing vicarious trauma. So, what does it look like? It looks like many, many, many different things. But what it can look like, a manifestation might be nightmares or disrupted sleep, depression like symptoms, so just feeling down, feeling discouraged, just not feeling like yourself. Anxiety, this might include being more on edge, being more hypersensitive, and then also that sense of hopelessness. For me, how I recognized I was experiencing some vicarious trauma and secondary burnout was I felt like I was on a hamster wheel, putting in all this effort, and I was not seeing any results. I felt absolutely hopeless, like I was not able to best serve my clients. So I felt that I was not able to do the work that I wanted, or not able to do the work I was putting effort into. So here is a quick rundown of what we are going to talk about today. We're going to talk about vicarious trauma, what that looks like on both mental and physical health, and how it affects you as a professional. Then we'll talk about ways to prevent burnout, what that looks like, self-care techniques. I know we can, many times we talk about self-care, but like, what does that truly mean? What can you do to make sure that you get out of a situation if it is causing burnout and you're not able to do your best work? Ethical implications. We always want to make sure that the code of ethics is driving the work that we do. Are certain providers impacted more than others? What does that depend on? And then support in the workplace. What can you do when you need to go to your colleagues, when you need to support your clients? How do you reflect? How do you manage this in a world where we now have a lot of hybrid work or virtual work? And then we'll talk a little bit about DEI as well and what that can look like in the workplace. So, vicarious trauma, what might this look like? What are some of the effects that you might experience? Or this is also good to know that maybe you're in an agency where you're seeing coworkers are experiencing this. Emotional numbing or detachment. So maybe you or your colleague just seems a little bit off. They don't seem like themselves, right? Maybe a little bit more withdrawn. Depression and anxiety, that might have been a shift from what you have seen with them prior. Anger and irritability, so maybe appearing very on edge or having a short fuse or just being more generally disagreeable. Difficulty sleeping and nightmares, of course, we know that stress can cause these symptoms. Difficulty concentrating and memory impairment, this might be where you're forgetting details of things. You feel like you're looking at documents or you're reading things and nothing's starting to stick in your brain. That's also poor concentration can be a sign that you are experiencing some vicarious trauma. And then we discussed this before, but a sense of hopelessness or helplessness. And for me, that was, I feel like I'm doing so much with no results and I do not feel effective. And I just feel really down on myself, truthfully, which was not a good feeling to have when you don't feel effective or that what you're doing is even helping. So this is what it might look like, some of the symptoms and how this affects different parts of your life. So you might have difficulty functioning at work, right? Maybe you're missing deadlines, or maybe you're taking more sick days because you're actually getting sick. We know that there is a mind-body connection. Strained relationships, this could be with your people in your household. So maybe you come home and you're really irritable and you and your partner are not getting along, right? Because oftentimes we take this stress out on the people that we love the most. Maybe you're starting to have physical health problems. So are you getting sick more often? Do you feel that maybe your immune system is taking a hit? We know that this is all tied, right? So poor diet, poor sleep, stress, it can all lead to some health problems. And maybe you're just not able to heal yourself because you are so run down. It's important to note that this could be a more of a snowball effect. So it's not as if one day you just wake up and you're all of a sudden feeling different. It usually manifests over time. And this could be, say, a client that you're working with, or maybe you're working in a agency where you're seeing a lot of clients with trauma and you don't even notice that over time you're really burnt out. Maybe you're overworked. Maybe your caseload is too much and it's just a lot to take on. I always tell others, being a mental health professional is very challenging. We hold a lot of space for our clients, and we have to have boundaries, but we put a lot of effort and a lot of our emotional energy into our clients. So like I said, it might be a snowball effect because we do care a lot about the success and well-being of our clients. And what's most important is that you're self-aware. So if you are starting to hit that breaking point, or you're feeling more tired and you're just not feeling like you're your best self personally or professionally, that might mean that you are experiencing some of the effects of vicarious trauma and you might be starting to have burnout due to that. So vicarious trauma is difficult because it often presents like stress or burnout, but there is a different root cause to it, right? It could be because you are exposed to others' stories. You're holding space for those stories. For example, when I worked in a school, most of my clients had experienced trauma of some sort, or they were encountering ongoing trauma. They went back to homes that were traumatic for them on a daily basis. And that really started to weigh on me. I needed to get a lot of supervision. I had to take, time, mental health days, because it can be a lot. So it's really important that you are just tuned in to your own physical body, your own emotional health. And there's those 8 pillars of self-care that's going to be really important that you are taking care of all 8 of those things, because it can manifest this differently from person to person. And sometimes we don't even notice it because we're so in the weeds, right? And maybe a partner's like, you, something seems off, something's not quite right with how you're acting. So notice if others are starting to notice as well that maybe your behavior is a little bit off as well. So, what are some other things that may be indicators that you're experiencing vicarious trauma? Avoiding certain people, places, or situations that remind you of the traumatic event. And remember, this is the event that the client faced, but it could be triggering something in you. Maybe there is some transference and counter-transference going on in that relationship, right? Maybe you have been in a prior accident, and working with this client is bringing back those things. And now you are not, or maybe you're avoiding certain places because you're getting triggered by it. Maybe you're having a change in your personality, more irritable, anxious, or upset. We talked about the physical symptoms, fatigue, headaches, and muscle tension. This is a big one, difficulty maintaining professional boundaries with clients or patients. Sometimes when we are hitting that point, our boundaries start to go down because we feel so helpless to want to help. So we might be doing more so for some of these clients than we would with other people. And if that is the case, we need to make sure that we are processing that and making sure we're setting those boundaries, right? And understanding why we are maybe flexing our boundaries a little bit. If you feel that you're not very effective right at that time in your role, that could be a big one. That for me was what I noticed. And then you might even be turning to substances to kind of cope, or to de-stress, or to take the ease off of things, and more so than you usually would. Some people have difficulty sleeping, so they might start adding alcohol to their nightly routine, or they might start isolating from people and not going out and doing things, not seeing friends in social situations. So what are some factors that contribute to this burnout, right? Prolonged stress. We know this job can be stressful, but there's certain environments that are more stressful. Is your workplace one that is a positive workplace? I've worked in many negative workplaces, and I had to leave that job because it was not working for me. Long hours. Are you working too many hours, right? Are you being asked to take on more clients than is reasonable? Do not have any support. We often can be on an island, and we don't have people that are there to help us, to really help us work through these difficult cases. So that's why it's really great to find a supervisor or a peer or someone that can help you process these things. Lack of self-care. And of course, we all in a perfect world would love to engage in self-care, but sometimes we are so burnt out and so strapped for time, we don't have that luxury, right? We have to pay the bills. We have to make ends meet. High workload, that's a huge one. Oftentimes we are overburdened. Our caseloads are very, very high, which can cause burnout. And like I said, it depends on your setting. So if you are in private practice, if you took on 30 trauma clients a week, that's going to be very, very, very intense, right? So, and sometimes we don't have any control over our workload. So that's something to think about too. Role confusion. Is your workplace making you take on roles that aren't necessarily in your job requirements? That has happened to me many a times. And then ethical dilemmas. Those are always so tricky. Those are those gray areas where we're not really sure what to do. And being faced with these ethical dilemmas, it really takes a lot out of us. So burnout's when we get to that state of physical, emotional, and mental exhaustion caused by prolonged stress as a result of many things, but definitely can be a result of vicarious trauma. And I like this visual here because sometimes when I'm overwhelmed, I feel like my brain is like that. It just feels scattered. I can't seem to untangle what's going on in there, and it's really difficult to think. So that is spot on how my brain feels at times when I am super burnt out. So I don't need to preach this to you all, but of course, self-care is important. But the problem is when we are approaching burnout, we don't really have the time to do these things. So we need to make sure that we are weaving these in when we can. Regular exercise, and no, I'm not saying go to the gym and lift weights and do all these things. Even just standing and getting out, maybe taking a little walk outside of your home. Nature is healing. So getting some UV light if you are in a climate that you can do that. Spending time outside, getting some fresh air. Healthy diet. Of course, we would love to do this in a perfect world, but when we're stressed and on the go, sometimes we're getting the quickest thing, right? Or we're missing meals because we're working the long hours. But diet can really play a big role in our self-care. Are we eating too much sugar? Are we having a balanced diet? Are we doing all the things that we need to do? Another thing is sleep. Sleep is so important. We want to make sure that we're getting adequate sweet sleep, because when we're not sleeping, we're not able to do the things that we need to do. So if we're not getting enough sleep, we're not getting enough time that we need to be able to reset. Sleep, sleep, sleep is important. And if we're not prioritizing sleep, we're not going to be able to be our best selves. Relaxation techniques. So this could be yoga or meditation or guided imagery. It could be a variety of things. And this does not have to be something that costs money. This could be something that you do for 1 minute a day, right? Just start small and build up from there. Relaxation techniques also for me can be just stepping away from my desk for a few moments or putting my head down and just not looking at the screen. Time with family or friends, whoever you find as a support to you, can be really helpful. That can help you reduce feelings of isolation and loneliness. And some of these things, like when I'm down or I'm burnt out, I don't want to exercise. I don't want to eat healthy. I don't want to spend time with family, right? I'm burnt out. But that actually feeds it more. So then we actually feel worse because we're not doing the things that our body needs. Okay. So you're feeling burnt out, or you're seeing that you're approaching this because you are experiencing this vicarious trauma, or it's compounded over time. What do you do? What do you do? What do you do? So you definitely want to get supervision and seek support. So it's really important. I am all 1000% for clinical supervision, no matter what level of licensure you're at. I've been doing clinical work for 8 years now, and I still seek supervision, and I really, really appreciate mentorship. So a supervisor or a mentor or a colleague can provide a safe place to talk about your experiences and your emotions and what's coming up for you. Because sometimes we might not even notice, like, I feel really sad after I see that client, or I feel really angry after I see that client. Like, what's coming up for me? And why is that coming up for you? Important things to consider. Team debriefing. So if you are able to do peer supervision or peer consult or weekly meetings where you can bring cases to the table so that you can discuss that, that's super important. And what I have found is a lot of times colleagues are such a great support. They know what we're going through and they can lend a listening ear when we need it. Training. It's so important. We are lifelong learners as social workers. We have to get our CEUs. So it's important that we learn new skills to increase our feelings of competency and control. I know that if I get a really difficult case, sometimes I experience imposter syndrome. I'm like, I don't feel equipped to be dealing with this case, and I might need a little bit of extra training, or I might need to read up on something just to brush up on our skills. We can't possibly know everything and go as deep as we would like with every client. This one is so important. If possible, take time off and find a job or an agency or an environment that's going to allow you to do this. So it's really important that you are taking the time that you need it, taking that vacation time. Like, I cannot stress enough, take every day that you have available, because you just need to reset. Sometimes like people like to take long weekends every once in a while. So maybe take a Friday off or a Monday off to just give yourself that extra time. And then, if possible, I know this is not possible at a lot of agencies, but if you can have some flexibility in your schedule, and flexibility could be that you get a protected lunch break, right? Working in schools, sometimes that did not happen. I was eating lunch or not eating lunch at different times every day based on what's happening. So having some control over your schedule, or at least time blocking, so you can have some time to do notes or to take care of yourself, to eat lunch, to refuel, that's really important. Job rotation. For me, this is something that has become more present for me. I had worked in schools for many, many years, and I just needed a change. I truly did. I moved to private practice. I'm still working with children, but being able to have a different role and do things from a little bit of a different perspective has really recharged me in a way that I did not think that it would. Most agencies, most employers will offer an employee assistance program, and this is usually through insurance. And you might, depending on what your insurance is, you will get sessions to help you connect with, or even get a few sessions of mental health support and well-being. Use these, and if it is confidential, so your work does not need to know about it, but it's a really underutilized benefit that a lot of people don't know about, or there's stigma around it. Like, I don't want to use the employee assistance program. Like, that shows that I'm weak, or that my boss is going to know that I'm using it. That's what it's there for. Stress management workshops, if you can attend these, or if there are free, I'm always trying to find free stuff, free self-care events that you can go to. Maybe it's an activity in the park, or it's a free yoga class, or a free guided imagery or something. There's so many things out there, if you just dig a little bit, that you can do to help you manage your stress. Sometimes agencies will even bring people in to do some stress management workshops. And sometimes we have to advocate for that, right? No, we don't want more training on, I don't know, something that seems to be a new training that you take every year. We want to know what you're going to do about our stress level and our well-being and our self-care. Organizational changes. Sometimes agencies have very poor policies or procedures in place, and that can cause burnout, right? Not having protected lunch times, not having limits on how many clients you can take. I often find that often in certain roles, if someone is not trained in mental health, they don't understand the impact that working directly with clients can have and how exhausting that can be, right? It takes up a lot of energy. So they might be very removed from knowing what this toll this takes on us. So we might need to have someone advocate for us. And in some cases, the best intervention you can do is leave that agency. If it is stealing your peace of mind, if you are not well because of the job, it's not worth it. So something to think about too. Is it worth it? Do you need to maybe start to look for a new job that's going to be more in line with what you need to be the best mental health professional that you can? So I want you to take a few minutes here and just think about these questions. So these are some things to think about. Self-awareness is key. So we're going to take a few moments here for you to just, if you have a piece of paper, you can pause the recording, you can jot this down, but I want you to think about this. So how do you prevent burnout in yourself? Is it something you think about often, or is it something that you don't think about it until you are at your breaking point? What interventions are most effective for you? What works for me is not going to work for someone else. So how can you tap into being the most in tune with what you need that's going to be realistic and effective, right? I remember in grad school, I'll never forget this. It was in my master's class, and it said, self-care is so important for social workers. You should try and get massages on a monthly basis. And me and my colleagues and my classmates, we just thought that was so hilarious. We were grad students. We had no money. How are we going to be able to pay for monthly massages? That would not be practical for most grad students, right? So find something that's going to be effective for you. And that can be time-wise, is it effective? And cost-wise, is it effective? Everyone's going to be different. And priorities. People prioritize different things. If you work in an agency or you are in a leadership position, maybe you are a clinical supervisor, how do you prevent burnout in others? Maybe that's people that work below you. Maybe that's people that are your colleagues, but how are you preventing burnout in your organization? And then this one's really tough. You got to dig a little bit deep for this one. What signs of burnout are you able to easily identify and which are more difficult, right? Some people, they're like, I know, they're very in tune with themselves. They're like, I know that I am approaching burnout. And others, they're not able to identify it as easily because a lot of times it's become a pattern. It's like, how do we even know what burnout is when you've been in a constant state of burnout for a long time? So I want you to just take a couple minutes to either jot this down and think of some takeaway points that you can consider about burnout and self-awareness. Okay. If you did not have the time to do this, you can always go back to this when you do have more time, but I do really encourage you to think about this because sometimes we don't take a minute or we don't have a minute to stop and think about these things. And I do encourage you, if you are a supervisor or do hold a leadership position, you are talking about vicarious trauma and talking about burnout with your colleagues and with your employees. Okay, so what do we do? How do we boost, just how we would walk our clients through this? How do we help our clients get support? How do we help ourselves tap into our own support systems, right? I think we do a very good job of connecting our clients with supports, but sometimes we don't do a very good job of doing this for ourselves. So, who can we tap into to help us here when we're needing some support? And it's okay to ask for support. It's hard. We oftentimes want to be the fixers and the doers, but we can ask for support. It's okay. So I wanted to normalize that. It's okay to ask for support. So that might be family and friends, and they might not understand, and you might not be able to share the details, right? Confidentiality should be protected at all times, but they've probably been in a job or in a situation that's stressful. So they can provide emotional support, understanding, and just let you kind of have space to process, right? Maybe they're going to be the ones watching TV with you. Or when you're just having a bad day, you text them like, I'm not doing very well right now. Maybe they can help with that. Cannot talk enough about colleagues and supervisors. If you have a difficult case, make sure you have someone that you can process that with. It's such a valuable tool. And I do not know where I would be in some of these cases that I'm working on without the role of my mentors and my supervisors. Support groups. So if you are going through something that requires a little bit more support, you can always join a support group, right? Maybe if oftentimes sometimes we feel some of this vicarious trauma because we have internal wounds that have not been healed. So maybe, like I said, this is bringing up stuff that we didn't even know was going unnoticed for us. So a support group might be really helpful. There even are support groups out there that are specifically for mental health professionals. So find something that works for you. And if you're someone that thrives off of connection with other people and that's helpful, a support group may be a great option for you. We know how important mental health is in seeking therapy or counseling, but I want to make sure that we are getting professional help when we need to. There is no shame in mental health professionals getting mental health help. It's essential. So it's if you notice that you're going through a rough time and you think you would benefit from therapy, I encourage you to take this step and reach out and do it. It can be a very good coping strategy and it can help you get some skills, or it just gives you a place to process, right? Think of what we do for our clients. They can do the same for us. And then if you are religious or spiritual, you might tap into that. So you might use leaders in your church community or your spiritual community to lean on to provide guidance and support. Okay. If you are in an agency or an environment where there's multiple employees, multiple people, this is some things that you can do in a team or an organization. And like I said, this can be really helpful if you are in a leadership position, or it can be helpful to bring as an advocacy point, right? Sometimes HR has no idea what it's like to be involved in work like this, and they might not be advocating for the needs of mental health professionals because they might not know. So education and training, it's really important that staff that are working with very intense cases that revolve around trauma that could be susceptible to vicarious trauma, it's important that there's training given to them so they can be aware of what this looks like. They can prevent burnout, and they can just be more self-aware. Putting it out there on the table that this can be an issue is important. Developing a trauma-informed culture. We have talked exclusively about some workplaces, but sometimes workplaces are not trauma-informed, and we're not going to be able to do good work in an agency that's not trauma-informed itself, right? So self-care should be prioritized. There's checklists out there of how an agency can be trauma-informed, what that looks like. We do not want to be re-triggered ourselves when going to work. So it's really important that reducing the risk of vicarious trauma, reducing the risk of being traumatized by the workplace is something that is considered. We talked about interventions, so that should be supervision, or maybe your agency is able to give you outside supervision if there's no one that is a mental health provider at your agency. Stress management workshops we talked about, promoting well-being. You will know when an agency takes mental health seriously, and you will see that they're doing some really great things to promote that. And if you're feeling unsure that a workplace is the appropriate place for you, just take some time and self-reflect and think about that, because you can not be your best self for everyone else if you're in a workplace that is not conducive to your well-being. And it's hard. We sometimes have to leave really toxic work environments, but sometimes that's the best thing that we can do for ourselves to protect ourselves and protect our mental health. You want to make sure that you are part of a supportive environment. It's a safe space. You feel comfortable in this space. You feel comfortable with the people around you. People can ask for help and not be shamed about it. It's supportive, and people are there to really help each other along. And then reviewing policies and procedures. Are there organizational policies or procedures in place, or are they outdated? Do they make sense? Do they help reduce the risk of vicarious trauma? Do people higher up in the agency understand the risk of vicarious trauma or what this can look like? So these are just things to consider that, when you're in your everyday work, you might not be thinking about. Okay, let's talk ethical implications. So, as stated in the NASW Code of Ethics, social workers have a responsibility to maintain their own well-being in order to prevent harm to clients. This is huge. So we need to be our best selves so that we're not putting our clients in danger. And when we are burnt out, or when we are experiencing boundaries blurriness, that's when we could potentially put clients in harm. And not because we want to harm our clients, but because we are doing this without even knowing. So social workers who are experiencing vicarious trauma or burnout may struggle to maintain this responsibility, because we know our clients that are burnt out. We know ourselves when we're burnt out. We're not thinking as clear as we maybe should, or the lines are a little bit blurry, or boundaries are a little bit blurry. So this can lead to ethical dilemmas, which can be really sticky. And remember, at the end of the day, I do not want anyone to lose their license, especially if you're burnt out. That's not, of course, what anyone wants to see. So taking care of yourself is really important so that you can protect yourself and the well-being of your clients. So here are some examples. Difficulty in maintaining professional boundaries and objectivity, which can lead to poor decision-making and harm to clients. And this could be both ways: having very rigid boundaries where you're harming the client, or letting those boundaries go down a little bit. And maybe you are having a dual relationship, or you are experiencing a conflict of interest. Difficulty in providing competent and effective services to clients. So this could definitely be if you have those high caseloads, maybe you're so burnt out, you're starting to forget things, you're maybe showing up late to work because you're sleeping in. So a variety of you're maybe missing meetings due to being overworked. And then difficulty in maintaining confidentiality, which can lead to harm to clients. Always, we have to protect confidentiality. And sometimes when we're past our breaking point, we start to make mistakes. And that's just because our brains are not firing on all cylinders. So it's important that we protect our own well-being so that we can protect our clients. And this can be done by preventing and managing vicarious trauma and burnout. So it's super, super, super important. And I've mentioned this many times before. It is often a gradual snowball effect. It's not usually that this just happens out of the blue. So it's a pattern that might be becoming worse over time. So I do want to mention that this could have a trigger warning for some people. So we are going to go through 2 examples of what might be vicarious trauma a social worker could potentially face. And these are just examples. A student may express frustration and anger about the systemic injustices and discrimination they face as a homeless individual. They might share experiences of being denied housing opportunities, facing prejudice from landlords or authorities, or being stigmatized by society. Hearing about these systemic barriers and witnessing the client's ongoing struggle against them can be deeply distressing for the social worker. The social worker feels helpless that they cannot change the system, causing hardship for the student. So this is an example. Maybe you are working with a student and their family is doing everything to secure housing. As we know, we live within systems and there's a lot of barriers within systems. But to see this family being denied over and over and maybe facing prejudice from landlords or not being able to secure housing, and then what that has, that affects, or that stigma that is associated with that can really start to weigh on someone. I've actually heard in situations where teachers or other staff members have wanted to take families into their home to help them. That could be a boundaries issue, right? So this is an example of, and if you work in a population where there's multiple students like this can be really hard, right? You feel helpless. You are starting to worry about them outside of work, right? Like, oh my gosh, like what is going on at nighttime? Where are they going to sleep tonight? And of course we want to help people, but we want to make sure that we still have those boundaries, and we want to make sure that their cases are not coming home to haunt us as well. Here's another one. Social workers in a PICU, and that stands for Pediatric Intensive Care Unit, may encounter ethical dilemmas related to treatment decisions, end-of-life choices, or resource allocation. Navigating these complex ethical issues can contribute to emotional exhaustion and secondary trauma. Their personal beliefs and the need to remain impartial and respect parental autonomy may create moral distress for the social worker as they think about the potential consequences of each decision. And in here, if you're working in a PICU, some cases might be life or death, and the emotional toll it may have on the child, the parents, and themselves. So if you are in a setting where you experience these life or death situations, it's children, sometimes it's not really clear what the best course of action is, you could definitely be experiencing vicarious trauma because you might be questioning, did I make the right decision? Did I do too much? Did I not do enough? Or you might be sitting there seeing parents make decisions that you disagree with. And that is weighing very difficult on you, especially if it's related to death or terminal illness or life-saving procedures. So these are just 2 examples, things to think about that could lead to vicarious trauma. And like I said, every setting is going to be different, and every situation, every client's going to be different. So here's some signs, and this has actually obviously been researched for quite a bit because this comes from research in the 90s, the late 90s. Signs you may be experiencing vicarious trauma. And this was an article written, and it says that there's 3 levels that your life might be impacted. It says here transformed, that may indicate you're experiencing vicarious trauma. The first is feelings of vulnerability and fear. I'll give an example of that. difficulty trusting in personal relationships, or a changed view of the world. So I'll give you a few examples for each of these, but if you're starting to feel this way, this might be something you need to process with a supervisor, or something you need to think a little bit more about what is causing you to feel this way. So feelings of vulnerability and fear. This could be that you work, an example, you work in a school and you live in the community and there has been some sort of community violence. And where you used to feel comfortable walking around your neighborhood, now you are staying inside, you're isolating because you're fearful that there will be another violent event. And so what has been going on in your school community is causing you vulnerability and fear. And that's just an example. Difficulty trusting in personal relationships. An example here could be if you work with survivors of domestic violence and you keep hearing their stories over and over again, and you keep being exposed to the cycle of abuse. And now you are starting to see your own personal relationship. You might be not so trusting, or you might be fearful that your own partner is going to do something to you. That'd be a difficulty trusting in personal relationships. And then just a changed view of the world. This is hard when we're social workers because we do see so many things, but that you maybe have some negative self-talk, like the world is just an unsafe place. People will never find happiness. If you're starting to have some of those changed negative views, that could also be a sign that you're experiencing vicarious trauma. So how do you support your clients and how do you support your colleagues? Because we might actually both ways be experiencing vicarious trauma, but our clients might also be experiencing vicarious trauma through their own interaction. So we are in an interesting position because we're kind of on that two-way street with it. So active listening, of course, you want to be encouraging to them. You want to build rapport, and you want to make sure that you have a safe space for them to do so, right? So they feel truly, fully comfortable to be able to do this. You can listen to them and just offer support that way. Validation, validate their feelings, right? They might feel shame around these feelings, or they might feel stigmatized to even share it. So validate it for them, right? That can go a long way. Of course, empathy, we want to show understanding through what they are going through. And we might be the only people doing that. They might have outside people saying, suck it up and just, you need to push through this. Or you might even have personally your own mental thoughts telling you to just push through it. And it's really hard sometimes to ask for help. And then you, of course, want to help to identify coping mechanisms. So what works for them, or this might be skills teaching, right? What can they tap into, or what can you introduce them to? This could be mindfulness, meditation, deep breathing. It can be a variety of different things to help them cope. Referrals. So if you have a client that needs, or if you have a coworker, a colleague that needs some resources, provide them. You can suggest that they maybe use the employee assistant program, or if you have a list of referrals that you can share that you feel comfortable doing that, you can. But if you are just talking with your coworker, you need to make sure that you're not providing therapy to them. That would be a conflict of interest. That would be a dual relationship. That would not be appropriate. So something to note there. Follow up. You don't want to just say, oh, I've noticed you're having some difficulties, and then never follow up from there. We want to make sure that they're doing okay. So maybe a week or 2 weeks after, say, how are you doing? I just wanted to check in because I know things were really stressful for you. Encourage self-care, right? So we preach this a lot, but is it practical in real life? But make sure that they're engaging in any activity, even if it's just like going for a walk with you around the block in between clients, or hopping on the phone with you, or just something that is an easy way to connect that allows them to regenerate when they're experiencing this burnout. So here's some discussion questions to think about again. So if you have that piece of paper handy, now would be a good time to kind of jot them down, or just think about some food for thought. What support systems do you rely on to avoid or manage vicarious trauma? Maybe you don't have any support systems right now. So who can you utilize to build up that support system? And then how have you helped clients or colleagues identify effective support systems? Like, what does that look like? So take a few moments here to just think about this and make a game plan for what you would do if you needed to rely on your support system. Okay. Resilience and coping strategies. So we know what resilience is, we know what coping strategies are, but do we engage in them, right? That can really help us regulate our nervous systems. It can just really help us reconnect. So self-care could be exercise, mindfulness, spending time with loved ones. And I always encourage people to kind of have a self-care check-in with yourself. It's like, are you taking care of yourself? Because there's different times in our lives where we're doing a better job of this than others, right? Life gets busy, things get in the way, and we're 6 months into something and we haven't actually taken time to take a step back and reflect. Social support, connecting with friends, family, professional support systems. We've talked about that a lot, and that can help actually with resilience as well. Positive thinking, I'm not here to just say be positive, right? But it is hard sometimes when we are exposed to so much trauma to not see the world as a very negative place. So think of some positive things in your life or some things that bring you joy in your life. So I'm not saying, oh, just think the world is perfect and have rose-colored glasses, but I am saying that it is important to point out the positives in your work or in your life or with your clients. Humor, right? Humor is very, very healing. So maybe that is you watch something funny or you are just like laughing with friends. Like, how many times have you been out with family or friends and you just have such a good time laughing and being silly together? Problem solving, that's definitely a coping strategy. And sometimes when we are burnt out, we don't have the capability to problem solve. So how can we develop strategies to solve them, build resilience, and reduce these impacts of trauma? We should probably think things through and have a plan. That would be some good problem solving techniques. Professional development is key, right? So you definitely want to make sure that you are bettering your career, you're learning, we're lifelong learners, because these are some effects that vicarious trauma burnout can have: difficulty focusing on work tasks, decrease in productivity, difficulty building and maintaining professional relationships, difficulty making decisions, disengagement from work, difficulty feeling satisfied with work. If this is happening to you, you're probably not going to be very happy, and you're probably not going to be your best employee. So it is important to know that when we are experiencing vicarious trauma to the point that it's affecting our professional development, it's a problem, because we start to make mistakes. Then we can have poor job performance. We might even feel so burnt out we leave the profession, and we don't want people to leave the social work profession. We want them to continue to do the great work that they're doing. But sadly, this is the reality. So it requires a lot of self-reflection, but I encourage you to tap into this and to do this. Supervision and training, we've talked about this a lot, but it's really important because we cannot do this alone. So tap into the power of supervision and the power of training or professional development, continuing education opportunities. So what can supervision and training do? You can build awareness, right? You have someone to reflect on. Sometimes supervisors are like, I can see you're really carrying a lot here, right? Let's talk more about that. How are you doing? Someone to check in with. So you might be able to develop some strategies for recognizing and managing this and those tough cases that just sit with us. That's a great, great, great way to utilize supervision, right? Some cases are going to be more mild and some are going to be more intense. And those more intense ones, oftentimes with that big T trauma, can be really, really hard to separate ourselves from. You can also enhance resilience and coping strategies. You can work on self-care and compassion, ethical dilemmas. So if you're kind of stuck on something or you feel like you're put in a weird place and you don't know what to do, you should definitely process that with a supervisor. And then you can feel more confident, competent, and satisfied. Make sure that you are doing ongoing trainings, right? Like, it's so great to learn new knowledge and learn new skills. We always have areas that we can improve on. Do you self-reflect? So we know self-reflection is really powerful. So self-reflection is the process, we know what it is, of thinking of our own thoughts, feelings, and actions in relation to a specific situation or experience. So maybe you had like a really tough session and you're just going to take some time to think like, what happened there? Right? Do I need to journal it? Do I need to talk with someone about it? Do I need to process this in my own therapy session? It, once again, going to keep saying this, it's okay to seek help. We help so many people, and it's okay for us as mental health practitioners to seek help for ourselves. Self-regulation, self-reflection, it helps us better understand our own vicarious trauma or our own past trauma that's leading to this. And hopefully this would help with mental and emotional well-being. So find something that works for you. I'm not saying journaling is going to work for everyone. Some people, various outlets help, right? Journaling for some people. Some people like to do art. Some people do other more nature self-reflection activities as well. Here's some more discussion questions. So once again, think about these, kind of take some notes. What are you going to do with this? Have you discussed vicarious trauma with your supervisor or supervisees? If you haven't, I encourage you to maybe think about it and bring it up as a point of discussion, right? Because if we don't talk about it, we're not able to process it. And then, do you engage in any self-reflection practices? Why or why not? And I definitely encourage you to engage in any self-care practices or self-reflection practices. So in this moment of reflection, think of one you maybe do well and maybe one you'd like to add to your repertoire. So go ahead and take a minute or two to just kind of reflect on these. Okay. Moving on. DEI. You have probably heard about this. Sometimes it's called DEIB, diversity, equity, and inclusion. The B stands for belonging, and this is something that has been a big push in a lot of organizations. So vicarious trauma does actually intersect with diversity, equity, and inclusion, and this can be very complex. And you might be like, what? How does that intersect? So let's break this down and think about it a little bit more. Trauma can have an actually more profound impact on marginalized communities who may have experienced discrimination and oppression in their daily lives. So if you're working with employees of color, or you are working with employees that are members of the LGBTQ plus community, it's important to know that they might be experiencing things at a more intense or deep level, because they might be feeling the effects of that, right? They might experience that on a daily basis, and that can sit very heavy with them. Additionally, if you work primarily with these communities, you might be at a higher risk for vicarious trauma because there are so many things happening that to these different populations that could be something that is weighing heavy on the professional. So just things to think about. And like I said, we do not live in a perfect world. So this can be really challenging to see some of these injustices and inequities exist and feel that we can't really do that much about them. So we definitely want to be mindful of this. If your work does not do anything with diversity, equity, and inclusion, I encourage you to include it or have a speaker or someone come, because it's really, really, really important and we cannot ignore it. So if DEI principles can help create a safe and inclusive environment, this is for clients and professionals. And we talked about it. Is your agency, your place of work, is it trauma informed? Because that can be really problematic if it's not. So it's important that for DEI purposes, staff understand and acknowledge the ways in which trauma and oppression intersect. We no longer live in a world where it's okay to pretend that we're not going to talk about it because everything's okay, right? That is not respecting the voices or the lived experience of our marginalized communities. We need to prioritize the needs and perspectives of marginalized communities and be open to hear what their unique needs or experiences might be. This is huge. We need to be aware of our own bias and privilege, and this includes our implicit biases, right? If you do not take time to reflect on this, that's problematic. So take some time. What are your own biases? What is your own history? What's your privilege that you bring to the table or to your workplace? We need to provide trauma-informed care that is culturally responsive and inclusive. So we do not want to have a one-size-fits-all model. We want to make sure that we are respecting all cultural backgrounds in a way that is going to be best for that client. And we don't want to make blanket statements that, oh, we're just going to do this for this this group. That's not going to work. We need to do the work to understand the individual needs of all of our clients. And then, of course, we need to create a safe and inclusive work environment. And speak up, I will say. If you are experiencing some injustices or things that are not really sitting well with you, as social workers, like, it's important that we advocate for this, right? And it can be hard because sometimes the people in power might be our boss or write the paychecks, but it is so important that we speak out and promote these safe and inclusive work environments. So we now live in a world where virtual and remote work is really common. So this has some challenges. It's great in that a lot of people can work from different places. We can reach maybe some of those hard to reach populations that would not be able to come in for services. But there are some things and some challenges that we need to think about as it relates to trauma. So it can create a sense of isolation, right? So that could be for the client as well as for the provider. And also it can be sometimes hard virtually if you have a really tough session to kind of feel the emotions of the client because you're talking to them through a screen. So this could actually make feelings of vicarious trauma feel more intense, or those feelings that you're just not doing enough or you're not connecting with them. Those can feel more intense if you are working remotely. And people have a preference. Some people love to do virtual sessions where others prefer in-person sessions. That's going to be the same for practitioners as well as clients. But make sure you're not alone on an island. If you are someone that maybe work for yourself and you only work virtually, you're finding ways to connect and process, and you're not feeling so isolated. So here's some things you can do to kind of help address some of these intense feelings or these feelings of isolation, these feelings of vicarious trauma. Make sure you're scheduling check-ins with colleagues or other people so you're not sitting in front of a computer screen for 8 to 12 hours a day with no connection with people outside of your clients. That can be really, really tiring, and it can be emotionally exhausting, and that's how burnout happens. If you have the option, join a virtual support group or peer supervision. A lot of it is done virtually now, so that is a good option. Of course, self-care and reflection. You can provide training yourself on virtual settings and how this vicarious trauma manifests specifically to the virtual setting. Breaks and time away from work. This could even be, like I said, leaving your computer, taking a walk, getting out for lunch every once in a while, because I do not work. I do a mix, but if I do not plan to get up and walk around or take a break, it gets really exhausting. You start to get a headache. You're just like, how long? What time is it? What is going on? We need some connection to the outside world. Creating a virtual space for discussing vicarious trauma. Maybe you are part of a professional network that you could post on maybe some sort of listserv. Making sure that if you are someone that works in a virtual setting, that managers and supervisors understand, have knowledge of this, and have the resources to support their employees. Self-compassion. Of course, we need to talk about self-compassion, and this is treating oneself with the same kindness, concern, and understanding that one would offer to a friend or loved one. This is not easy, right? We can say, yes, let's practice self-compassion, but it is so hard to do. We are often very hard on ourselves, and we feel that we have so much burden on us. We want all of our clients to be successful and to heal. But it's really important that we do practice self-compassion, because we can't heal everyone right? We can do the best that we can do. And it's important to just give yourself some self-compassion. Know that you are doing your best. And this self-compassion, this mindset of, knowing that you're doing the best that you can, offering love and understanding to yourself, this can actually counteract feelings of self-blame, guilt, and shame that come with working with some of these clients with trauma, right? You might feel like, wow, I really failed that client, but maybe practicing some self-compassion and just, I did the best that I could in that session. And then research has actually shown that self-compassion can help reduce symptoms of vicarious trauma and burnout because it increases our well-being, resilience, and emotional regulation. Hard. It's one of the hardest things I have to do as a clinical therapist. It can be so hard. We blame ourselves often because we do want the best for our clients. But sometimes we do that at the cost of our own mental health and well-being. Mindfulness is great. Self-awareness, of course, is going to be very important too. Mindfulness refers to paying attention to the present moment with an open and non-judgmental attitude. There are tons of apps out there that you can do, or podcasts where you can just do like a mindful minute. I sometimes do it before bed. It can be super quick and easy. It does not need to be that you're sitting meditating for an hour a day. It can be something, when you're driving to work, you're practicing mindfulness, when you're brushing your teeth, when you're getting dressed for the day. But it's important that we are aware of our own thoughts, feelings, and behaviors and not placing judgment on it, right? So just noticing what the feeling is and letting it be. So this can help individuals recognize when they're experiencing vicarious trauma because it allows us to connect, right? It allows us to just be more present, which will be really helpful when we are feeling like we're just running on empty. We're just go. Take a minute to step away and just kind of have time to connect with your mind and your body. So what can you do to practice this or make this part of your routine? You can do mindfulness, meditation, yoga, whatever works for you. And like I said, this does not have to be you're sitting meditating for an hour. It could be a minute or two daily. Pay attention to your thoughts, feelings, and physical sensations during the workday. What times of the day are you feeling most stressed? Or are you getting a little bit more irritable or sleepy or just cranky, right? What time of the day are you most productive? These are just good things to know because everyone's going to work differently. What are your reactions to difficult situations and clients? Do you recognize when this comes up? And do you process what's going on for you? How do you separate yourself from this? Because I know so many times we feel like we had like a really tough session, or we just had a really bad conversation that didn't go the way we thought, and we take that with us and we let it fester, and that's not good. So journaling can be really powerful. We talked about that, to track your thoughts and emotions. And then I cannot say this enough, supervision is really important, or going to therapy if you need to, if you're feeling anxiety, depression, anger, dysregulation, a variety of things. Now I want you to take another minute to reflect on a few things. Discussion questions. If you work remotely or hybrid, how do you manage vicarious trauma? Like, who are your supports? What self-reflection activities do you do? How do you manage this? Do you manage it? Do you have any self-compassion or mindfulness practices that are especially effective for you? What are those things? Have you gotten a little bit further away from them? Do you need to reincorporate or be a little bit more purposeful about adding them back into your routine? And then anything that you would like to try. And I love yoga, but I got out of it for a good 9 months. I just did not go at all. And I was like, I'm just going to sign up and go. And that was about a month ago. And I have been on a great trajectory of going once a week. And it has totally changed my mood completely. So it was something that I had totally fallen out of. And I was like, I need to get back to it. I've talked about it for months and months and months. And then once I finally did, it felt great. So is there anything you'd like to try or reincorporate into your schedule that maybe has fallen by the wayside? So thank you for tuning in to this CE event. If you need to contact us, you can contact us at agentsofchangeprep@gmail.com, or you can go on our website under the continuing ed section. We're constantly finding new topics to present on based on your interest. If you are interested in reaching out because you would like to offer continuing ed to our community, please let us know. We are always looking for dynamic people to be sharing their wealth of knowledge with others. And I want to thank you for taking the time to learn with me today. And if you are interested in any of our resources, our bibliography is listed here that you can go ahead and check out a little bit further. So thank you for tuning in. I hope you enjoyed this continuing education course from Agents of Change. Want to earn your CE credits for this course? Visit agentsofchangetraining.com or the link in the description to purchase the course and take the post-test. If you're looking for more CEs, check out our unlimited plan. You will get unlimited access to 150 plus ASWB and NBCC approved continuing education courses for one low annual fee. We're always adding new courses. Did I mention we also have 5 free CE credits available too? Check it out at agentsofchangetraining.com.